Hi, my name is Josette Medina, and I will be doing my presentation on scope and standards of nursing informatics. International Council of Nurses is part of a health system, and it encompasses the promotion of health and with prevention of illness and physical ill, mentally ill, and disabled people of all ages in healthcare and other community settings. Nursing informatics, also known as NI, is a specialty that integrates nursing science, computer science, information science to manage and communicate data. Information, knowledge, and wisdom is in nursing practice. NI supports consumers, patients, nurses, and other providers in their decision making in all roles and settings. AMI A is short for American Medical Informatics Association. It defines the nurse's informatics core areas of work. One is concept, representation, and standards to support evidence-based practice with research and education. Data and communication standards to build a national data infrastructure. Research, information and communication technology, vision management for development design, and definition of healthcare policy to advance in public health. The standards of nursing informatics practice includes two components. One is standards of practice and the standards of professional performance. Each one is a company-measured criteria that provide more detail about expected knowledge, skills, and abilities necessary to meet that standard. Some standards include additional measurement criteria specific to informatic nurses, specialists, and their role and practices. Three overarching principles are inherited in every aspect of nurses' informatics practice and should be considered by informatic nurses and informatic nurses specialists addressing these practices. It incorporates the theories, ergonomics, systematically determines social, legal, regulatory, ethical impact of an informatics solution with the nursing healthcare. Standards of nursing informatics practice. One of them is assessment. The informatics nurse collects comprehensive data, information, and knowledge to any patient's situation. They collect the data, information, and knowledge in a systematic, ongoing process, such as like an assessment to refine the issue or the problem. The other one is involved in the patient, family, nurse, and healthcare providers and key stakeholders as appropriate to holistic data collection. Prioritize data collection activities based on the intermediate or anticipate needs of the situation. Use appropriate evidence-based assessment techniques. They also facilitate problem solving with the available data, information, and knowledge relevant to the situation, identifying the patterns. They document relevant data in a retrievable format, kind of like a flow sheet. Problems or issues. So the nurses analyze these assessment data and determine if there is the problem or the issue, and it involves like process and diagnosis and validation of the problem. It includes a documentation of the issue in order to facilitate and determine of expected outcomes and a plan of action. Outcomes and identification. The informatic nurses identify expected outcomes for the planned individual to the situation. Once the problem is identified, it is important to seek the solution. It's necessary to discuss associated risk and costs. Communication with family and other nurses and healthcare providers is essential. Then there's planning. The informatics nurses develops a plan to prescribe strategies, alternatives, and recommendations to attain expected outcomes. In this plan, clinical and business characteristics and the environmental situation must be considered. The plan has to be developed in conjunction with this patient, kind of like I would say, like it's like you have a team of doctors, nurses, like therapists or whoever has to be in your planning, so that way you could develop a permanent strategy for your diagnosis. Implementation. So in the development of the plan, the nurse implements the identified plan with documents and modifications that may include changes or omissions depending on the patient's response to the initial plan. They do coordination of activities, they help teach education for the solutions, and they do a lot of consulting. Evaluation. The informatics nurse evaluates progress towards attainment of outcomes. They always keep this in the flow sheet so that way they could know what is going on with the patient, if it's resolving the issue, and they have the timeline too, and what medications work and what doesn't. Standards of professional performance. Education. So nurses must always attain knowledge and competency that reflects current nursing and informatics practice. Each nurse has to participate in educational activities. I think they're called CEs, and it serves as an important tool to conduct a solid professional base. It's acquiring in specialized area, and it's very important. Professional practice and evaluation. The nurses evaluates one owns nursing and informatics practice in relation to professional practice standards and guidelines and relevant statutes, rules, and regulations. They always have to make sure that that as themselves are up on their CPR or their AED. Quality of practice. So nurses systematically enhances the quality and effectiveness of nursing and informatics practice, documenting the application of the nurse's process in a responsible, accountable, ethical manner in its own way to demonstrate quality. This is required by ANA. Also, this is for nurses that contribute to the professional development of their peers and colleagues. For nurses, it's very important to share knowledge and skill with peers and colleagues at formal or informal meetings. Professional conferences help as well. This helps very much to grow professionally. Collaboration. The informatics nurse collaborates with key stakeholders and others to conduct nursing and informatic practice. They collaborate. A documented plan focuses the outcomes and decisions related to management of data, information, and knowledge to deliver healthcare services. It's also known as like case management. Ethics. The informatics nurse integrates ethical provision in all areas of practice. That involves using the code of ethics for nurses with interpretative statements. Sorry, I can't even say that. The guide practice and employing informatic principles, standards, and maintain all patient confidentiality within legal and regulatory parameters, also known as HIPAA. Research. The informatic nurses integrates research finding into practice, identifying clinical nursing and informatics problems and issues specific to nurse research, participating in data collection such as surveys, participating in committee or program formal meetings, sharing research activities and finding with peers and other conducting research, critically analyzing and interpreting research for application to practice, using research finding to develop policies, procedures, and standards of practice in patient care, incorporating the research as a base for learning. We call that retreat at Children's Hospital. It's just, we all get together, we have a subject, and we research it, and we come up with new policies and procedures on how to obtain that in our unit. Research utilization. Nurses consider factors related to safety, effectiveness, cost, impact on practice in planning and delivery services to achieve expected outcomes. Advocacy. Nurse advocates for the protection and rights of patients, healthcare providers, organizations, institutions, and issues related to data information knowledge. ANA is also involved in this. The last one, leadership. Nurses provides leadership in a professional practice setting and the profession. That means that nurses engages in teamwork as a team player and a team builder, works to create and maintain healthy work environments in local, regional, national, and international community, displays the ability to define clear vision and associates goals, and a plan to implement and measure progress, demonstrates a commitment and conscious lifelong learning for self and others, teaches others to succeed, and mentoring in others in strategy. And that's my references, and thank you very much.